Dental hygiene and therapy interviews in the UK are super competitive because it's a really competitive course to get into, with more and more people applying every single year. There have even been more universities opening up courses for dental hygiene and therapy. For example, check out the University of Lincoln, which is opening their course soon, Teesside University, which has started a January intake for the dental hygiene course, and also Essex University, which has introduced a full dental hygiene and therapy program alongside their foundation degree. But you come to this video to find out about interview practice. So interview practice is so essential for dental hygiene or therapy. You have to be prepared going into these interviews because they're not easy. Now, it varies massively between universities. So each university has a different interview style. Some have panel interviews and some have multiple mini interviews. I've got a longer video on multiple mini interviews. What I really want to go through is the situational judgment style question. So the ethical scenarios where you have to talk through a scenario and your management of it. And I think a lot of people trip up on this, and especially people who haven't prepared. You're never going to know the exact model answer. And honestly, I don't think there is a model answer for these questions. I do have a guide with loads of past interview questions, really good model answers. But again, it's just about how you approach the scenario and knowing the keywords to use, when and how. So let's start off with one example. The first one is going to be, what would you do in a situation where you're working as a dental hygienist, but your nurse is coming in to work late every single day? What are you going to do in that situation and how would you manage it? The thing you should do is repeat back the scenario, show you understand the scenario. So in this situation, I understand that my nurse is coming late into work every single day. I imagine this is affecting patient care. They're coming in later than normal. It probably means we're seeing the first patient later than we should be, and this is likely having a knock-on effect to the rest of the patients. So immediately there's two things that I'm considering. I'm thinking about the nurse. Why is this suddenly happening? Is this a new thing? I'm also thinking about patient care as well. It's always really important not to jump the gun and not to give an answer straight away. Just zoom out, look at the scenario as a whole, consider the different factors, and then go into more and more detail. So the first thing I'd consider is the nurse's feelings, what's going on. I'd take them into a separate room. I'd be really polite, really non-judgmental. I'd want to ask what's going on, the reason behind why they're late. Could it be that there's new roadworks, or could it be that their child is unwell and they haven't been able to get in on time because they have to make extra adjustments? What is going on? So first, just be non-judgmental and hear them out. Also, well-being is so important. Teamwork is so important in the dental field. You can't work without the nurse. The nurse is literally your left hand. They have such a key role in the dental team. So just showing that you understand that is really important. Also be aware that there's the patient side of it. So the patients are being affected. The first patient is not going to be seen on time if the nurse is coming in late. This means that the patient is being affected. Maybe they've taken time off work. This can cause patient frustrations, and you're sacrificing the patient's quality of care if you start to rush treatments, which should never be done. Patients shouldn't ever be rushed. It's also going to have a knock-on effect to the rest of the patients for the remainder of the day, and that's going to have an impact overall. So you want to recognize that, and you want to share with the interviewer that you notice that patients are being affected and something could be going on with the nurse as well. You'd want to speak to the nurse, and you'd want to remind the nurse that you have patients to see, and this could have an impact on patients, or it has already been having an impact on patients, and you're there just to support her, whether that's making adjustments, whether that's moving patients later, or working with the manager to come up with some sort of temporary solution. Want to explain both sides of the scenario, mention the key words like being non-judgmental, being really polite, understanding both sides of the situation, showing a lot of empathy and really good communication skills to manage that scenario. If it's a temporary solution that can be implemented, you can work with the manager to make that happen. What would be a red flag in this situation is jumping the gun and reporting the nurse to the manager without even speaking to the nurse straight away. Always best to speak to the person directly. Does depend on the scenario. In this case, you can just take the nurse aside, speak to them, find out what's going on, and then address the situation, take it step by step. I do have model answers to ethical scenarios like this in my guide, but I just want to emphasize there's no real model answer. It's just about thinking about all different factors, and looking through scenarios like this can really help you to kind of gauge the best way to approach it. Second scenario I'm going to give to you is your friend has stolen the exam paper. So you're a dental hygiene student and one of your friends has gotten hold of the final year exam paper. So this means they're going to cheat in the exam, and they're going to have an unfair advantage. So you need to talk through a scenario like this. So I would start off by saying, okay, so I understand that my friend has gotten hold of the final year exam paper. So this means that they have an unfair advantage and they're going to be able to pass the exam a lot more easily because they've already gotten the answers or able to look up the answers beforehand. So this isn't a true test of their knowledge, and honesty and integrity comes into play here. So the first thing I'd be thinking is, how did they get hold of the exam paper? Do other students have this exam paper? What are they planning to do with it? So again, approach really non-judgmentally. Speak to them one-on-one and ask them questions. How did they get the exam paper? Does anyone else have it? You really just want to understand their situation and what they're going to do about it. So I'd ask them directly, what are you planning to do with the exam paper? Are you planning to hand it in? That is the best thing to do. In an ideal situation, the supervisor should be informed, or a clinical tutor. Someone should be informed, someone higher up who is aware of this, who can make sure that changes are made to change the exam paper so everyone can take the test fairly. You also need to look at the long-term implications of this. If nothing is said, your friend is going to cheat in the exam. Other people might cheat as well. Some people are given an unfair advantage, and it's an integrity issue. It's not being honest. What that means long-term is somebody who's passing their exam with insufficient knowledge. So technically they're not safe to treat patients. If they've been cheating in an exam, they maybe don't have the right clinical knowledge to be able to pass those exams. You could start to see how just approaching the situation, just zooming out and talking about it, considering all factors, just shows really good communication skills without jumping the gun straight away and giving an answer, jumping to a conclusion, yep, I would report it straight away. Always try and speak to the person first, consider all the factors, show empathy and good judgment. The third scenario I'm going to give to you is, what would you do if you come onto the clinic, you're a dental hygiene or therapy student, and you notice the supervisor has been drinking or smells like alcohol? What would you do in that situation? This is a really tricky one because it's someone who's already senior to you. So who do you go to? The first thing is, I've noticed that the supervisor smells of alcohol. My biggest concern would be patient safety. So it seems like the supervisor is under the influence, and they could have been drinking on the day, they could have been drinking the day before, a couple of days before. I don't have that answer. I don't know clearly, but I do know that patients are at risk here. So that's the main thing that I'd be concerned about. In this situation as a student, if I'm unable to speak to the supervisor directly because I feel they're under the influence, I would try to find another supervisor or maybe a manager, basically a senior member of staff, someone that I could speak to. I try to approach them quietly in an area where patients can't hear what's going on. The last thing I'd want is patients to have mistrust in the profession. I want to maintain professionalism, but I need to make sure in this situation that the supervisor isn't treating any patients because they can be at harm. That's one of the GDC standards, is put patients' best interest first, make sure that they're safe, and at this point they're at risk. So I'll speak to a senior member of staff. I understand there's only so much I can do as a student, so I'll speak to a senior member of staff, make them aware of the situation, and ideally allow them to follow the steps necessary to make sure that that supervisor is no longer treating patients. That shows you how to manage situations like this, and there is no model answer. Thinking about the different factors involved, always think about the patient, think about good communication skills, how you're going to express yourself, how are you going to report this to someone else quietly, confidentially, and make sure that you're not jumping the gun. A red flag is if you're jumping the gun, going to the GDC, the General Dental Council. There's absolutely no need to report this individual to the General Dental Council. You'd follow the steps, step by step, and in this case, it's speaking to a senior member of staff. I have loads and loads of scenarios just like this on my interview guide. If you are interested in having mocks, I have really limited slots for dental hygiene and therapy mocks, but it really helps to practice these scenarios on the spot. There are so many different scenarios that you can practice. So practicing on the spot, preparing with someone else can be really, really helpful. It can also help to speak to someone who can give you a different perspective. Oh, you didn't think about this, or how about this? Maybe there's another way to approach this. And it just takes practice and preparation. So good luck for your dental hygiene or therapy interviews. The interview guide links will be in the description.